Welcome back, Richard. We only have a few weeks left of May. Here we are.
What is it today? The 12th? Yeah, that's right. Oh, you know why? The reminder is schools are winding down.
That's right.
This academic year is coming to a close. Graduations, graduation parties. That's right. That's a sure sign that's the end of the school year.
Yep, it's there's just a couple weeks left. There's a few weeks left of school, and and it's just a few weeks left of May, which is Mental Health Awareness Month. And we haven't talked about it at all because we've had a few other things that we've talked about over the last few weeks, but we thought we would spend today talking a little bit about Mental Health Awareness Month 2023.
Right. Yeah, and this year's theme is look around, look within. And as it turns out, you and I have been doing a little bit of that in our podcasts, asking listeners to consider some things that we find interesting and useful about mental health and mental illness. And so if we look at these two things, look around, if you look around, you're going to recognize that people are struggling. People seem to be struggling more now than they have in our recent memory. I mean, most people are coming in as most people say they're really, really struggling. There's a couple of explanations. One is I think everybody agree that we're still struggling with pandemic fatigue.
Yeah.
Not only the physical effects, there was a program this morning about long COVID, the biology of long COVID. One of the Supreme Court justices yesterday made a statement that the pandemic restrictions were the greatest incursion into our freedom than at any time in history. So it's a topic that not only has physical implications, but it's exhausting us mentally to keep talking about it. And then the second thing is, I think this divisiveness that we feel in our country about this us versus them mentality, that you're the enemy. And there are people saying that no, you're not just a different political party. You're my enemy, and I have to destroy you. It's not good enough to win the argument or to have policy decisions. You're my enemy, and I must defeat you. And I think that's also making us tired. This constant fighting and bickering and battling.
Yeah, I agree.
Disagreements, but destruction.
Yeah, and I think that the example you just gave with the Supreme Court justice is a great example because, there's of course always going to be hindsight and disagreements about different things, but stating that the decisions that were made during the pandemic and some of that was the biggest incursion on our independence and freedoms and things like that. Those are very bold and divisive statements, right? Because you can't prove how many lives it saved to make some of those decisions. You can look and see how many negative consequences. That part is sort of easy to see, but you can't measure how many things it prevented from happening.
Yeah, so people were dying by the thousands in the beginning of the pandemic. I mean, and we didn't know why. People were getting into people were dying by the thousands. Somebody had to make decisive decisions. And what else would you do? Just let people die? Oh well, we need to have our freedom, so we're just going to let 20 million people die. I don't know that anybody would have voted for that.
Right. Now, the other half of the sort of the mission or the goal of Mental Health Awareness Month this year is to look within. And of course, that's something that we talk about often here on the podcast, as far as looking at your own mental health and trying to, take an active role or an active part of solving and finding resolution for your own mental health and emotional challenges that you may be experiencing.
Right. And what we talked about a couple of weeks ago was that, in fact, most of us are probably not mentally ill, or we don't have a mental illness. What we have is something we call existential crises. what we mean by that is these are just life challenges. I mean, the air conditioner breaks and the refrigerator stops working and there's a hurricane or there's a tornado. These are, you run out of money before you run out of days, these are life challenges that we face. And so if we take the first part of this is look within, let's take stock. And there's an article that Martha Gill wrote. She's a writer for her company. It says the definition of mental illness has widened so much that it's become almost meaningless, is the title of her article. And we put that in the show notes. One of the reasons this is happening, one of the main reasons it's happening is the slow medicalization of our lives.
Yeah.
Okay. Lots of things make us anxious, but we don't necessarily have an anxiety disorder. I might be anxious. That doesn't mean I have anxiety as a mental health or as a mental illness.
Right.
Okay. But she says, when you include grief, for example, and there was another, I think it's called prolonged grief, where it goes on longer than it should, whatever longer than it should means. We've included grief as a mental illness. Well, grief really isn't a mental illness. It's a life crisis, that we all face. But if we keep including these, I think you and I saw this with the diagnosis of autism. We put autism on a spectrum. Well, where's the dividing line between being shy and having autism? I don't know nobody knows where that line is. Nobody can say where that is. And so we sort of normalize. If we say kids who are shy might have autism, and we're normalizing and we're making it normal to have autism, so you start to include mental wellness into the definition.
Right. Yeah. There's so much, we forget that there's so much variability within normality that that anything that's outside of, anything that is outside of comfortable, we see as a mental illness or a health related problem. When
That's right.
You mentioned autism, but the same thing could be said with, if we're sticking with children,
ADHD.
same thing could be said with ADHD. If a kid is having a difficult time sitting still in class, well, he probably has ADHD. Well, if he has learning difficulties, or if he's not sleeping, if he's hungry, there's lots of reasons why a kid may not sit still in class. It doesn't mean that they have ADHD, but yet, depending on how adults around interpret the behavior, it may be diagnosed with ADHD or a conduct disorder or oppositional defiant disorder or all kinds of other things. So we're looking to label things so quickly. And I think in part we try to do that because we want to identify what something is. And if we feel like if we have a name and a label for it, then we can come up with a strategy for something to do about it. But we can't do that without one of those labels. We talk to families and people all the time who have struggles in their life. They're dealing with different things in their life. They don't necessarily have a disorder, but we can still work on strategies and approaches for dealing with things.
Right. And, it's not surprising that the three most common mental illnesses are ADHD, depression, and anxiety, because I think in each case, it's really difficult to, take depression. Is it depression, or are you just in a slump? And how do you make that distinction? So I think we need to be careful about pathologizing or medicalizing what our human condition. Okay. And the third explanation for this medicalization is that we're all beginning to use terms like we have to set boundaries, or this serves as a trigger, or I need to do self-care. So this sort of psychological language has seeped into our common vocabulary, and we're beginning to think that way. That maybe I have this or that, and maybe I have to set boundaries, and maybe I have to watch out for triggers of my. Well, these are sort of normal life conditions. It doesn't. We shouldn't be medicalizing these things.
Right.
Now, the good news in all this, to say, not to be afraid of this, is there's less stigma about mental illness in general, especially what we call any mental illness like depression or anxiety or ADHD. But in an effort to destigmatize, which is a good thing, we're normalizing mental illness so much that we're beginning to include people who are not mentally ill, who are mentally well.
Right.
I think there are a lot of people who are diagnosed, who get a diagnosis today, who really aren't mentally ill.
Right.
Okay?
Yeah.
So the bad news, right?
Yeah.
The bad news in all this
Right.
is that we're much more tolerant and accepting of what we would call mild mental illnesses, any depression, anxiety, ADHD, even autism. But while that's happening, the stigma against the severely mentally ill is increasing. And I think we need to keep that in mind, that yes, as far as any mental illness is concerned, the mild mental illnesses, if you will, the stigma is decreasing, but with the severely mentally ill, it's increasing.
Right. And I think with that comes this idea that whenever someone behaves badly, we immediately attribute it to mental illness, to a serious mental illness. And we see that often with, when we see mass shooters and things like that, everyone immediately goes towards mental illness.
That's right.
While on one hand, we are normalizing some aspects of our mental health and stigmatizing, some common diagnoses that we see with people. There's the other side that we're really pushing to stigmatize those areas that, okay, those people with those kind of conditions are dangerous.
Right. That's right.
And it's really especially challenging and concerning when we see people, if not outright talk about it, outright say it, but then you have people in leadership positions who are exploiting that as a way to create fear and to make personal gains.
That's right. Yeah, every time there's a mass shooting, some elected official gets up and says, well, this has nothing to do with guns. This is about mental illness. Okay. Well, you're immediately stigmatizing the mentally ill, and you're stigmatizing the seriously mentally ill. So not only are we not solving the problem of severe, and we're not solving the problem. I mean, who are the homeless? In most cases, they're severely mentally ill, and we're not solving the homelessness, right? We're not solving. I don't even know who's addressing the seriously mentally ill. People say all the time, well, if somebody's really mentally ill, where can they go? Well, we don't have places anymore. We shut them down in the 80s. We closed the mental health hospitals.
And we've talked about this for years, that the only mental health hospitals now are jails.
They're prisons, right? That's where they're going. I mean, the seriously mentally ill get their mental health care in jails.
Right. Yeah. The most of the people that I've ever worked with who have serious mental health conditions, mental illnesses, it was through the legal system that I was evaluating them or seeing them. And so, again, we're not doing anything to solve those problems. What we're doing is we're saying, well, those people are dangerous, or those people, do things that necessitate them to be, locked away or to be separated from the rest of society. And we're not, instead of solving that problem, we're stigmatizing them, and we're saying that we need to stay separate from them.
That's right. And if you think about the crime shows on TV, if you watch it, those are about people with serious mental illness, but it makes them scary. Okay. Right. And so while the destigmatization has been, while it's been good for the mild mental illnesses, for those individuals with severe mental illness, things are getting worse. Okay?
It makes me think of, my early research was with Tourette's disorder.
Right.
And anytime I ever told anyone that I worked with people with Tourette's disorder, the first thing that they talked about was something called coprolalia, which is where they have where one of their tics is to say curse words or insulting things. And there's something else called I believe it's just called copropraxia, where, you know, they'll do inappropriate gestures or things like that. And because of what we've seen in the media, on TV and in programs and stuff, people automatically associate Tourette's disorder with this most severe form of Tourette's. The vast majority of people with Tourette's disorder do not have that.
That's right.
They don't have anything close to that.
Mm-hmm.
But yet, because of the way that what we have seen on TV and in the media, that's immediately the image that people get when they think of Tourette's disorder and tics. Right. And it's just not the case.
Right. And if you don't know that about Tourette's, then your only image of Tourette's is its most severe expression.
Absolutely. Absolutely.
Mm-hmm. Right.
So that's how we get these pockets of stigma where we are still, you know, despite the fact that we have, you know, people coming out and talking about mental illness in their personal lives, you know, thankfully, for whatever reason, you know, we put so much credit on people who are like celebrities and people and athletes and things like that, who come out and say, hey, you know, I struggle with this mental illness. I believe people need to get help for that. It's fantastic that they will do that. But yet at the same time, you know, we stigmatize them in other areas.
That's right. Yeah. So, you know, Dwayne Johnson, The Rock, was the most recent. Okay. And I'm going to go out on a limb here, and I apologize, but Dwayne Johnson is a successful businessman and actor. Okay. Right. Now, he may have had bouts of sadness, maybe even bouts of depression. I'm not sure that he really had depression, because he wouldn't have been able to work and do all the things that he did if he were truly depressed. I mean, that severely depressed can't get out of bed in the morning. They can't. I mean, you and I both have patients who tell us, I spent 2 years on the sofa. Yeah. You know, well, Dwayne Johnson is working and acting and is very skilled at what he does. Okay. Right. So is it really mental illness? And I think we need to be careful when we say, well, I'm depressed, or I'm anxious, or I'm anything. It may not be a mental illness. It may be just your life. It just may be your life challenges.
Right. Yeah. I was watching a program the other day, and a celebrity was talking about her life experience, and they were showing clips of her in all these different settings. And she said, you know, and I always had a hard time in these public settings and walking into parties. And like, of course, when she talks about walking into parties, she's talking about walking into parties with hundreds of people. And she walks in and she's interacting with people, and you see all these videos of it. And then she says, but then I figured everything out because I was diagnosed with autism, and that helped explain everything. And all I can think of is, there is nothing autistic. Maybe you have some social anxiety, or you have some, you know, you feel a little bit stressed in those situations, but why are we pathologizing that?
You know, it's perfectly normal to be nervous if you're addressing an audience of 500 people. I mean, even professionals get nervous. Professional entertainers get nervous, get stage fright. It's not abnormal. Right. Okay? So I think we need to be careful about that. Okay. Yeah. Now, the next article that we have posted is kind of an odd, I don't know, this guy's kind of fun to read because there's a little bit of tongue-in-cheek or irony in much of what he says. But again, he pursues these same questions, and he has 2 or 3 questions here that he poses in the article. And he said, is what I am feeling an ordinary aspect of the human condition, or does it constitute a mental illness? Right. And he said this is especially important when it comes to medication, because there's a great deal, there's a literature being produced today about, do antidepressants really create brain changes? You know, do we think it's the medication? And are the medications treating brain conditions, or are they just numbing our feelings? Right. You know, you'll hear people say, well, I took an antidepressant, I wasn't sad, but I wasn't happy. Right. Okay, well, if all you're doing is numbing your feelings, then is it really treating serotonin in your brain? And we simply don't have the answer to that question. Right. But is what I am feeling normal human feelings, or is it pathological?
Yeah. And the next question he asks is, who decides
Right.
somebody has a mental illness?
Right.
And he's not talking about, a professional. What he's talking about is from a societal perspective.
Right.
How is it decided that this is a mental illness and this is not a mental illness?
Right. Right.
At what point is it that something is so pervasive or so much of an issue that that we say, okay, this is now a mental illness? We've talked before that the new Diagnostic and Statistical Manual,
Right.
the DSM-5, there's a text revision, the DSM-5 TR. There are hundreds of diagnoses in that book. And if you look over the past 50 or 60 years, there are hundreds of more diagnoses now than there were before. And so who decides what is now a disorder and what's not a disorder?
Right. Yeah. This whole concept of what is abnormal, just because something is rare doesn't necessarily mean that it's abnormal. I mean, it doesn't matter what we're talking about. Just because something is statistically rare, and Bernie, you and I say this all the time, it is statistically significant, but it may not be clinically significant.
Right. Well, and that's the that goes with what you were talking about with Dwayne Johnson a moment ago. Sure, right. He may have had periods of time where he's experienced significant depression, but how much of his functioning does it impair? And so at what point does that maybe authentic, true experience of depression, lowercase d, when does that turn into depression, capital D?
That's right.
And there's a line there that we're not sure who makes that decision.
Right. And we need to be, and that's why we need to be very careful, because if you take a blood test, for example, and your glucose levels are at a certain, you can diagnose diabetes or other illnesses by giving a lab test, thyroid conditions, for example. You'll see an elevated level of something. So in that case, a high score does have real life implications, okay? But a high or low score on a psychological test or even a rating scale may or may not have real life implications. Just because your score is at a certain level, high or low, it may or may not have any clinical significance. So you just can't say, well, you have this score, so you have this diagnosis. That's not how this works.
Right.
We can't just rely on statistical rarity. Okay. So we have to look at what are the real life implications. Is this person really depressed, or are they just struggling with some depressive symptoms? Okay.
Absolutely.
And most of us, and of course, if we use DSM-5, the issue becomes impairment. Some part of your life has to be adversely affected in a significant way. Not that you're feeling sad. That's not an impairment. Not that you're a little bit down. That's not an impairment. Right. You know what we're seeing today, Bernie? You can't open a website without seeing something about narcissism.
Right.
What a narcissist, okay? Just because somebody is an arrogant jerk doesn't mean that they have a narcissistic diagnosis, the diagnosis of narcissism.
Richard, I was talking to a patient the other day, and they were using that word, narcissism, and talking about it, of course, in negative ways, talking about it as it relates to a relative.
Right.
And I finally got to a point where I said, symptoms of narcissism, being confident, being arrogant, even feeling as though your answers are always the right answers, isn't necessarily a diagnosis of anything. If you think about it, you want your physician to be a little bit narcissistic, because you want your physician to say, I know what to do in this situation.
Right.
You hope that they know what to do in that situation.
Right.
But you want them to be confident. If you are going to run a business, you're going to have some narcissistic traits, because you have to be able to say, no, my company can do it better than those other companies.
Right.
Because this is what I have put in place in my company to make us more efficient. So those traits, just because a person has those traits doesn't mean that it's a problem. In fact, it could serve them very well.
Yeah,
But
I think that Tom Brady is probably a pretty confident guy, right? Or
right,
Wayne Gretzky, or anybody you want to talk about, who's at that level.
right.
Does that make him a narcissist? Because he's supremely confident, because he can do something that the vast majority of people could never do. Does that make him a narcissist? No, it doesn't make. He's very good at what he does. He's not impaired.
Absolutely. And when, like you said, talking about the issue of impairment. So the issue of impairment that comes in is when a person says, well, I think I have an anxiety disorder because I get really anxious anytime I'm put into this situation. And you ask, well, what do you do when you're in that situation? Well, I just take a deep breath and I just have to push through it. And then, and then it gets better after it's over. Okay. That may not necessarily be an anxiety disorder. That may be, that's a difficult situation for you,
Right.
but you're able to do it.
That's right. You can
Able
recognize.
to do it, then that's a good thing. We should be thinking, when we think about anxiety disorders, we're thinking about people, think of agoraphobia, people who lock themselves in their houses and will not leave. There's not a way to, people who truly have some of these conditions can't just push through it.
Right. And, you and I, you I don't want to say you stumbled on it this year, but it's a recurring theme in your work in the last year. Berney, if somebody comes into our office and their life has fallen apart, we don't have to give a test to document. There's no need. They're already telling us my life is in a sham. I can't leave my house. Okay. I don't need to do a test.
Right.
They've already given me all I need to begin treatment. I don't have to document anything. We don't. Maybe an insurance company or a hospital administrator needs to have a test result. But my goodness, if somebody comes into your office and tells you that, well, I haven't left the house for 2 years, I don't need to give a test for agoraphobia.
Right.
I mean,
yeah.
I'm failing all of my classes in school.
Yeah.
Okay, let's figure out, are you not doing your homework, or don't you understand what's going on?
Right.
That doesn't require an examination.
Let's just get to work on fixing the problem.
Right. Yeah. The problem is, I know, so that's why we have to be careful about these lines. Where is the line between normal human condition and mental illness? And I think we're pathologizing or medicalizing what is really not a mental illness. Okay. So that's what all this comes down to. Most of the time, I think it's safe to say that most of the time, most of us are experiencing life problems. We're not mentally ill. We're sort of life challenged. We're not illness, or we're life challenged. Okay. But having said that, there are times when life challenges tip us into mental illness. The other thing is, in addition to knowing that difference, and we're going to talk about that in a second, there is that difference, but it doesn't mean that you don't treat what is garden variety sadness or the blues or anxiety. You don't need a mental health diagnosis to pursue treatment, to get somebody to help you through these crises.
And that brings us back to what what the whole idea of Mental Health Awareness Month is this year. Look around and look within. You look around and you see what's going on, and you take stock of what's going on inside you. And if you're struggling with something, it doesn't necessarily mean that it's a diagnosis, but it may still need some support, some treatment, or some strategies to help you work through that. You can go through and have therapy to help you through decisions that you need to make and problems that you're experiencing in life. You can do that without a diagnosis. You don't.
That's right. That's right.
We all need help. Doesn't mean that you have a mental health problem.
Right. Yeah. There's nothing wrong with getting a tune-up once in a while. Your life is sort of going in a direction that you don't want. Well, take stock.
You don't have to have diabetes to say that I need to cut back on eating sugar so much.
Good example. It's a perfect example. Yeah. And then We also ask that you not be swayed by the exploiters, the people who try to divide us and exploit us and saying, well, it's a mental illness is the issue, and be careful. Don't be swayed by that, okay? Mental illness is complicated, and especially severe mental illnesses. There's just a great deal we don't know about them, and we're not very good at treating them. For our most mentally ill to end up in prisons says something about society, not something about mental illness.
Absolutely. And I think that, we need to remember that mental health issues, mental illness it's more than just an algorithm. So many folks will go online and they will do these, tests that you can find on Facebook or social media, and they'll go through and they'll take a test online and they'll get a score, and that score will say, oh, well, you may have this condition or that condition. It's more than just a list of symptoms. It's more than just meeting criteria on a test, or getting a certain score on a test. It's more than just an algorithm. If you feel like you're experiencing some of these difficulties, talk to a professional who can look at it and talk to you about it in a way that's going to make sense for you, and is going to help you work through whatever you're going through, and find some success and relief on the other side.
That's right. And when you're working with your therapist, make sure that you're not rushing to, that neither you nor your therapist is rushing to a diagnosis, because as we've said many times, chances are there's an 80% chance that you're not mentally ill, okay, that you're dealing with some challenges, yes, but it may not be a mental illness. So don't go rushing toward mental illness. This is it's more likely that the probability is that it's a life challenge, okay? And that treating symptoms, just because you have the symptoms doesn't mean you have the illness, okay? And so we have to do more than treat symptoms. So there's a line between mental illness and life, and it's about you and your struggle. That's what, as a therapist, I'm interested in, not your symptoms. I'm interested in your struggle, okay? Not your symptoms. I'm not interested in your test score. I'm interested in you. Symptoms, and they're like buoys. If you're out in the ocean, you see a buoy, that means something is there. Okay, so we don't know what it is because it's underwater. That's all that symptoms and test scores are. They're like buoys. They tell us something is out there, but we still have to find out what it is. And that takes skill and integrity to find out what it is.
Absolutely. Well, that's it, I think, for today. Take a few minutes. It would be great if we could do this every day. Just take a few minutes to look around and look within, and take stock a little bit in what's happening around you and what's happening inside you, and get the support and help that you need without necessarily, jumping to some type of pathology or some type of mental illness or something. Get the help you need first, and see where things go from there. So use
May to take stock of your mental health. We use New Year's Eve to take stock of our physical health, right? So use May to take stock of your mental health. Okay?
Absolutely. All right. Until next time, stay happy, stay healthy, and forget to be afraid.